Following the horrific events in Lewiston last night, Maine hospitals were swift in responding to those in need.
Grace Bradley spoke to one doctor at Northern Light Eastern Maine Medical Center to hear how hospitals prepare for mass casualty events like this one.
Certainly something on this scale is almost unprecedented.
Despite the rarity of mass casualty events in Maine, the threat of their occurrence can be anywhere at any time. Maine hospitals utilize preparation and coordination to provide necessary care in emergency events.
Our trauma teams practice these kind of things. They remain credentialed so that they can provide services, whether that be the victim of a car accident or a victim of a tragic gunfire or any other kind of major accident. We do have statewide agencies that help coordinate those kind of things, and we do have what we call practice sessions where we actually either sit down and just go over things as a tabletop exercise, where what would happen if we had an increased need in an acute situation that overwhelmed our services. And then periodically we will actually run those types of exercises as a real event. There was coordination between Central Maine Medical Center and Maine Medical Center.
What a hospital considers a mass casualty event all depends on their scale, capacity, and location.
From a healthcare standpoint, from us, it really has to do with how much resources are going to be needed or may be needed. Very different in our more rural towns, which already are stressed both in terms of hospital bed availability and emergency medical transport systems. Very distinctly different than in Bangor, Lewiston, or Portland, where we have a little bit more of those services. Of course, nobody can prepare us for when we're talking about such sadness that occurs after an event like this. But I think it is a constant reminder to those of us, particularly those of us that deal in the realm of public health and preventative health, that we do need to continue these preparedness kind of things.
Grace Bradley, WABI TV5 News.